40 countries have met to discuss the successes and failures of some of the communication campaigns run during the COVID-19 pandemic. The national workshop was convened by COVID Comms, a non-profit organization focusing on plain language communication in most South African languages. To talk to us about what came out of that workshop is the organization's chairperson, Chris Vick, who joins us now virtually from here in Johannesburg. Chris, thanks for your time this evening. You know, there's been a lot of talk and looking back at where we all were about 2 years ago. And I do remember in those first few months of hard lockdown, there was a big, important conversation happening on social media, because that's really the only place we could talk, where you led the way along with a lot of media, other media professionals and even journalists saying, but what can we do to try and get the message out there, to try and keep more of our communities and our people safe, because what they need to be armed with is information long before any talk of vaccinations ever happened. It does seem like a lifetime ago. When you think back to that time, what comes to mind? Because I remember at the time, the problem was that the communication wasn't available in all official languages, and it surely wasn't reaching South Africans in the vast rural parts of the country.
You're right, Marcel, and thanks for the opportunity to talk about it. I mean, we were reflecting on that today. So you said in your intro there were 40 countries. It was 40 people. I wish we could have had 40 countries.
Apologies. But
the 40 people there, it's okay. We're civil society people, government, labor, and business people who've literally been working every day for the last 2 years to try and find new ways of communicating effectively around the pandemic. And I think the general sense of those first few months, if you were, is we just lost so much time. We lost time because of digital vibes, stealing money. We lost time because of the focus on lockdown regulations, not public health information. We lost time because we weren't working together. It took about a year, in fact, to form the National Communications Partnership, which we're part of, and which was essentially the group that met today. All that time is lost opportunity. It's people who needed access to information and didn't get it, or who had access to information but didn't understand it. And what came through very clearly today was the importance of plain language communication, taking the science and making it simple and easy to understand, but also a much greater focus on mother tongue communication, because most of what government in particular has done, but also business and labor, has been in English. So you're compounding that information gap, which creates space for disinformation, which deprives people of their rights to take the right decisions, such as to get vaccinated. But having said that, I think we're in a better place as communicators. I think we're in a better place in terms of COVID. And I think that's partly because of the joint effort, the way in which the four social partners worked together, thought together, coordinated messages, coordinated campaigns, and started to have a real impact.
Now, you know, during lockdown, I spoke to various scientists who, especially in the first year, said, we don't have to go and reinvent the wheel. Look at what we've been able to do with getting information and logistics and just everything with regards to reaching people with HIV/AIDS, with TB, with all of these battles South Africa has already historically have had to face. They've found that the biggest success has been at community level. Do you think, from a communication point of view, that we learned that lesson fast enough, that we were thinking, oh, it needs to be digital this and Twitter that and Facebook that, and we forgot that it was at community level that South Africans probably respond the best to any kind of communication, really?
I mean, one of the first things COVID Comms did was look at the treatment action campaign work that was done around HIV/AIDS. The stark reality is that the conditions in lockdown made it very, very difficult even to print and distribute pamphlets, even to visit people in their homes, because you just couldn't have that sort of social engagement. So that's a major differential, I think, in terms of what the conditions were like and what the challenges were. But the other point that came through strongly in the workshop today is that a lot of the learning and a lot of the infrastructure that was used in campaigns around HIV/AIDS and TB was demobilized. Prof. Mashabela, for example, from the University of KZN, makes the point that we're very good at rising to the challenge when there's a crisis. But you also need a maintenance mode. You need to have systems in place so that when there is a challenge, when there is a crisis, you can activate them much quicker than we were able to do. And I mean, that's difficult in a state that's struggling to provide basic health care, right? To try and add on to that communication, community-level health activists. But unless we're able to ramp up to that, even if we learn lessons like we did today, we're going to run into exactly the same problem next time there's a pandemic. It's a real problem. It's part of the conversation, I guess, around the state's ability to provide basic needs. And communication and primary healthcare information is one of those primary needs. Unless that's addressed, as I say, we're worried we're going to slide back into the same situation we were in before.
It was something I thought about today. I went into a retail store to get something medical for my baby, and I pulled out the pamphlet just to double check it was the right thing. And I realized this thing is only printed in English and Afrikaans. And then I realized, but that's the case with most medication that you buy, whether it be over the counter or you take it yourself from the aisle. This is something that really, really needs to be addressed in South Africa specifically, where the rights of people to communicate in one of their official languages is supposed to be upheld by the Constitution. Do you think there's enough buy-in? I mean, it sounds like we need to get the pharmaceuticals involved as well.
Well, I think it's a broad consumer issue, not just the pharmaceuticals. I mean, I think we need to know as much about cornflakes as we do about the medicines we use.
True.
But the irony in South Africa is we're such a multilingual society, but there is such a shortage of multilingual capacity. I mean, it took us, I think, about 18 months to assemble a proper team that could work in all 12 languages. I mean, we produce radio slots in Kwekwe. We produce T-shirts in Kwekwe. We're able to do work in Swahili and Portuguese. But to assemble that team has been a massive effort. If you look at government, there's no translation capacity. The public broadcaster, SABC, which has so many multilingual radio stations, doesn't have capacity. So it's a sort of double-edged challenge in that the producers of information need to embrace, I think, firstly, plain language, and then secondly, multiplicity of languages. But at the same time, we need to develop the capacity to do that. The other conversation we had today, though, was that there's a real need to produce content in Isizulu, and then to translate that into other languages. Because what happens at the moment is we produce in English, it goes to our translation team, and you're sort of pigeonholed into a particular framework and setting and idiom. And often those idioms don't translate either. So we're hoping that out of our workshop today, at least, there'll be a broader conversation around the issue of language. For us, it's about respect. And it's about impact. But it starts with respect. I mean, we have to respect the languages that people speak, and we have to be able to produce the content that is going to convince them to get vaccinated, sanitize, etc.
Absolutely. Such a powerful word to end this conversation on, which could actually go on for much longer, but we don't have the time. It starts with respect. Thank you so much, COVID Comms Chairperson Chris Vick, joining us live from here in Johannesburg. We thank him for his insight, as always.